The third rail of American politics. That's what many call Social Security and Medicare. Why? Because most politicians don't want to touch them for fear of getting burned at the ballot box. Many politicians claim that reforming these programs isn't necessary and will hurt seniors, and they can't stand the thought of losing senior votes. These politicians need a refresher course in the facts. I know that we can reform these programs in a way that not only makes them secure for future generations, but also protects and even improves the programs for those who rely on them most. No one disagrees that the primary purpose of these programs is to provide an important social safety net. But the vast majority of beneficiaries are paying in far less than the value of benefits they will receive. In addition, the Supreme Court has already ruled that these benefits can be changed at any time. So instead of calling them entitlements, we should refer to them as what they are, social insurance. Yet many people think of them as entitlements because they have a false understanding of how these programs work. For example, many people consider Social Security to be like a standard pension. They think that the benefit payment they get when they retire is proportional to the amount of taxes that they've paid in during their working lives. In fact, the Social Security system is and always has been progressive, meaning that poorer retirees receive higher relative benefits than the wealthy. This is a critical distinction that makes Social Security a social insurance program, not a pension. So are there ways to reform Social Security and Medicare that reinforce their role as safety nets? Absolutely. Take Medicare Part B, the voluntary program that pays for outpatient physician services. Right now, 95% of beneficiaries in the program receive a 75% subsidy on their premiums from the government, regardless of their income and wealth. So a retired married couple that makes $150,000 in retirement receives the same government subsidy and pays the same premium as a single retiree making $20,000 and who may not have many assets. Clearly, this does not make sense. Also, most serious reform proposals to Social Security would have little to no effect on current retirees. Any suggestion otherwise is just a scare tactic. Addressing social insurance programs will require tough political choices. But if the public becomes fully engaged and demands change, our politicians will find the courage to act. Both political parties should stop the scare tactics and come together to reform these important programs. Our collective future depends on it.